Hi, I'm Dr. Brian Koffman, a retired family doctor and clinical professor. I'm also a CLL patient myself for 2 decades now. I am the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. And I'm here to share with you some important research that's been presented recently at major hematology conferences or in medical journals. And the next paper I'm going to talk about is one that I've entitled Zanubrutinib Causes Fewer Infections versus VENETOCLAX and OBINUTUZUMAB in CLL. Let's start with the bottom line. Serious infections are a key issue in CLL. Real-world data shows that they occur significantly less often with Zanubrutinib compared with VENETOCLAX and OBINUTUZUMAB. Who performed the research and where was it presented? Dr. Nicole Lamanna from New York City led a group of researchers who presented, and the full title is Serious Infections in Patients with CLL/SLL Treated with Combination VENETOCLAX and OBINUTUZUMAB compared to those treated with Zanubrutinib, a real-world study. This was presented at the European Hematology Association, or EHA's, Annual Congress in 2025 in June in Milan, Italy. A very similar paper was presented at the annual meeting in 2025 of ASCO, the American Society of Clinical Oncology. Let's go into the background. All chronic lymphocytic leukemia, small lymphocytic lymphoma, or CLL/SLL patients are immunocompromised to some extent, leading to a higher risk of serious and even life-threatening infections. There are now many excellent choices of treatments that can knock down the CLL/SLL for a long time, making disease progression less of an issue for many. This positive development is now making infection risk an increasingly significant cause of morbidity and mortality for all CLL patients. Treatments with lower risk could offer an advantage, especially for those who are at high risk from infections. Let's look at the methods and objectives. It was a real-world study that compared the incidence of serious infections over 12 months in patients with CLL/SLL treated either with fixed-duration VENETOCLAX plus OBINUTUZUMAB or continuous Zanubrutinib. Patients diagnosed with CLL/SLL who received VENETOCLAX and OBINUTUZUMAB from 2016 to 2022 or Zanubrutinib from 2019 to 2023 were included. The primary aim was to determine whether continuous Zanubrutinib therapy is associated with serious infections compared to fixed-duration VENETOCLAX and OBINUTUZUMAB in real-world use. Assessments were done at 12 and 18 months post-treatment initiation. Keep in mind that for the VENETOCLAX plus OBINUTUZUMAB cohort, in that combination, that therapy is usually given as a fixed duration, meaning that many patients would be off the therapy completely at the 18 months, while Zanubrutinib is given continuously. Let's look at the results. A total of 2,104 patients with CLL/SLL received VENETOCLAX plus OBINUTUZUMAB, and 2,650 received Zanubrutinib. Zanubrutinib was associated with significantly fewer serious infections compared to VENETOCLAX and OBINUTUZUMAB at both the 12 and 18-month cut points. Let's go into the details. At 12 months, serious infections were seen in 4.8% of those on Zanubrutinib, but in 7.9% on the VENETOCLAX and OBINUTUZUMAB combination. This is a 57% higher risk in the VENETOCLAX OBINUTUZUMAB group at 12 months. At 18 months, the differences persisted. This time, 5.6% of the Zanubrutinib patients that had an serious infection but over 10% of the VENETOCLAX and OBINUTUZUMAB group had. What can we conclude from this? There are many factors to consider when choosing a CLL/SLL therapy. A partial list would include patient preferences, other disease the patient might have, their personal risks, and what other medications they're on. What are their biomarkers? CLL history and prior therapies. What's the efficacy of the drug? What are its side effects? Let's look at the convenience. IV versus oral, limited duration versus continuous therapy, need for close monitoring and or hospitalization, and cost and insurance cover. But for some patients, infection risk could be an important factor to also consider. This study offers another important data point to consider when making a treatment choice. Online on the website, we give the source of the material titled Serious Infections in patients with CLL/SLL treated with combination VENETOCLAX and OBINUTUZUMAB compared to those treated with Zanubrutinib, a real-world study. We also give a link to the ASCO abstract. Thanks for your attention.